My name is Stefan Verheye from Antwerp, Belgium, and I will be talking about the DynamX Coronary Bioadaptor System as a novel uncaging platform for coronary revascularization. As you all know, despite the fact that we have very good drug-eluting stents today, we still are facing the fact that there are still a number of adverse events. They remain high over time, especially when you look at data of the Resolute trial and the ISAR Test 4 trial. You see that the numbers continue to increase, and that there's actually at a rate of 2 to 3% per year without any plateau. Recently in JAMA Cardiology, Greg Stone mentioned actually that the adverse events may be attributed to strut fractures, but most importantly to loss of vessel compliance, vasomotion, and the capability for vascular adaptive remodeling, among other factors. And that's why we think we have a possible solution here to overcome these problems. The bioadaptor has a similar acute performance to first-class drug-eluting stents. It comes with a bioresorbable polymer coating, and it elutes novolumous, and it actually is thin cobalt chromium 71 microns drug. One of the big differentiators of the bioadaptor is the presence of the uncaging elements that contribute the bioadaptor to adapt to physiology. These uncaging elements are at low stress regions of each ring, as you can see on this slide. And immediately post-procedure, as you can see on the left here, the uncaging element is intact, providing a radial strength during the healing phase, and therefore just behaving like any other best-in-class drug-eluting stents. However, when the drug has been eluted and the polymer is wearing off, then you have basically the two elements within each other, whereas the green parts is able to move within the blue, within the constraints, and therefore allowing the uncaging elements to disengage safely and therefore contribute to the adaptation to physiology. And this we have investigated in a clinical study, which was the DynamX Mechanistic clinical study in about 50 patients in Europe, where we were looking to evaluate the safety and the performance of the DynamX Bioadaptor in de novo coronary artery lesions. So we treated these lesions ranging in diameter from 2.5 to 3.5 millimeter diameter, and we had several lengths. What was important is that we were looking at a number of primary endpoints, obviously clinical endpoints, also QCA endpoints, and then very interesting, and I'll share with you the results on the IRIS and the OCT endpoints. So looking at the QCA numbers here, post-procedure and at follow-up 9 and 12 months, what is important to comment is the fact that the acute gain is at 1.63, which is very much in line with best-in-class drug-eluting stents. Looking at the follow-up 9 and 12 months, the late lumen loss is 0.11 and the median is 0.05. So basically what this slide shows here is that the acute gain is similar to best-in-class drug-eluting stent, and the low late lumen loss is maintained at 1 year. And in addition, it demonstrated safety and efficacy at 12 months. Now, when you look at the neointimal hyperplasia post-uncaging, you'll see that the numbers are very much in line with best-in-class drug-eluting stents. The numbers are very much the same. And looking at OCT, you see that the neointimal hyperplasia is actually very low. And also interesting to note is that you can sort of appreciate the uncaging where the elements are disconnected on OCT. From a clinical point of view, there's been no target vessel revascularization through 24 months, and you see the numbers here. There's been no clinically indicated TLR, non-clinically indicated TLR, and there's been no thrombosis. So actually very good outcomes. We have to focus on what are the real differentiators of this technology. And as I said before, there is the vessel modulation, the physiology, the adaptive response to physiology. And what the bioadaptor does is the preservation of the positive adaptive vessel remodeling, also called Glagov remodeling. And when you look at these numbers, you'll see that the mean vessel area increases by 3% over time. The mean bioadaptor area increases by 5% over time, whereas the lumen area remains unchanged. And that is very important. When you look at this cartoon here, and you compare the bioadaptor with what we know today, compared to the second generation or best-in-class drug-eluting stents, you see that in drug-eluting stents, the device and the vessel area remain the same, and therefore the lumen reduces. In bioadaptor, the lumen remains the same, but the vessel area increases. And that's the Glagovian vessel remodeling that we see for the first time with this specific device as compared to best-in-class drug-eluting stents. So that's a very important differentiator. Another one is return to vessel pulsatility and the response to stimuli. In other words, restoring vessel function. And you'll see on the left side the OCT. This is taken from a stationary OCT at follow-up, where you see that there are differences between systole and diastole. Again, something that we have not seen before with drug-eluting stents. The lumen area is about 40% different between systole and diastole. And the bioadaptor area is also by 9% different between systole and diastole. So again, a very important differentiator. Another characteristic that we have not seen before with drug-eluting stents is actually the fact that when you administer nitrates or other chemical stimuli, is that you see an increase in the lumen area pre and post nitro. As you're all familiar, you know that this does not happen with regular stents. And that actually illustrates the uncaging by the uncaging elements that we have talked about just before. Another important feature is the geometric dynamics. We talk about compliance and rotational movement. On the left side, you see that the bioadaptor, which is below, has a significantly greater compliance than the caged device, and this is taken from finite element analysis. Now, this has been very meticulously analyzed in a model, also using the clinical data that we have derived from the DynamX trial, and this has been recently published in Cardiovascular Revascularization Medicine, where you'd see that the DynamX basically restores the rotational movement. So you see the difference on the right side between the caged and the uncaged, where you the uncaged basically returns to normal vessel movement and rotation. So you have difference. There's almost no stress present any longer at follow-up. So those are very important features that we have been able to identify by using this technology. And then another one is the return to baseline angulation. We know this has been published in the literature, as you can see. This is an old paper from back in 2000, where if you have loss of angulation, then you have this goes together with a MACE, increased MACE rate. And so the bioadaptor, what it does, when you look at the angiogram, pre-bioadaptor, post-bioadaptor, and 12 months follow-up, you see that the angulation after putting the bioadaptor in the vessel goes away, but then actually comes back over time, allowing the return to baseline angulation. And when you're looking this at several patients, the most angulation, you see that the angulation comes back. And this is basically a consistent return towards the baseline angulation. So that is also a very important characteristic. So basically, altogether, what the Mechanistic clinical study has learned is that it performs similar to best-in-class drug-eluting stents in terms of implantation technique, deliverability, conformability, and radial strength while the vessel heals. It also uncages the vessel, and I think we've nicely shown this, to preserve positive adaptive remodeling and maintain the vessel lumen. Remember the Glagovian remodeling. And OCT has illustrated that Bioadaptor also restores pulsatility of the vessel and allows the vessel to return towards basal angulation. The Bioadaptor finally demonstrated an excellent safety profile over 9 and 12 months follow-up, and there's been no clinical events between 12 and 24 months. What is the clinical trial program still entail? Well, you see, we have the Mechanistic clinical study, which has been performed. There's also the New Zealand imaging study, and there's currently 2 large randomized controlled trials ongoing. There's the Sweetheart in the Scandinavian part of Europe, and then the Bioadaptor randomized controlled trial, where the Bioadaptor is being compared to the Resolute device. So we'll be awaiting the primary endpoint, which will be in 2023 of these larger trials. So in other words, there's definitely an evolution taking place. We've gone from POBA over BMS, DS, and BRS, and I think that now we are entering a new era where we're using the Bioadaptor, where lots of advantages have been described. Thank you very much for your attention.